Most times the nation focuses on common diseases that affect a large population, but the strange, deadly diseases are swept under the carpet. A section of MPs and anti-hemophilia activists now rally the state to turn attention to this disorder that makes blood clotting impossible, causing continuous bleeding and costs a fortune to detect and treat. Apparently, government has only one facility in the country that has the capacity to diagnose it.
This disease is here with us, and we need to bring it to surface to ensure that a budget allocation is done and adequate attention is given.
The range, I can give the range, for example, those who normally fall between 250, the child between 1 and up to around 6 years. As I said, it is weight dependent. A dose of those ones can cost us 9 millions.
So we see a gap in reaching out to the very many people, and actually this could be one of the ways we could reach out to these people to tell them that there are those people who, when they get injuries or cuts, may have their blood failing to clot.
The MPs now want the state to focus on equipping more health centers in the country to handle this disorder that most times has been mistaken for witchcraft among the locals. Here, victims share their painful experiences with lawmakers.
But we have a challenge, as they have said, of those factors. They are not available. And the challenge of the lab, because like in one family we might have tested one child, because of the test is very expensive, and we have about 3 or 2 more children that are supposed to be tested.
We are also now bringing to the attention of this country that because hemophilia exists and it is very expensive to treat, we may now need to do tests for those who have got bleeding tendencies, whether they have ever tested for hemophilia or not, to go for a test. Because you wouldn't like to have an abnormal gene to be passed over to the offspring.
Over 2,800 individuals are estimated to be suffering from the deadly disease. The situation now calls for state intervention to save the many lives of those suffering from the illnesses. Sabit Joseph, WS Television, Parliament.